Now, NARCOMS data has been used in 3 different studies that analyzed the impact of infections on people with MS. One of those studies is titled Effects of COVID-19 Infection on Symptom Severity and Disability in Multiple Sclerosis. What can you tell me about this study?
Well, in that study, we explored whether COVID-19 and other infections can affect the trajectory or the course of MS, how much disability a patient reports having, and their particular symptoms. So we use data from NARCOMS to understand the association of symptom severity and the incidence of COVID-19 infection and other infections. So we had 2,000 participants who shared that they had tested positive for COVID-19 in the past 6 months, and about 1,500 who had no COVID or other major infection over that time period. We also compared to about 800 people who were positive for COVID, and a subset of those participants, we had long-term data to see how their disease, their MS course, fared prior to infection and how it fared after infection. And after we adjusted for things such as MS treatments and their age and their disease history, what we found is very reassuring that COVID-19 had a negligible impact on the course of the disease, both in terms of the disability, and this is a patient-reported disability scale, as well as individual symptoms across the array of symptoms that MS can cause. So the change in the level of disability using that self-reported disability scale was negligible. And so ultimately, we found that there was no significant impact of COVID-19 infection on either the disability progression over time or the severity of symptoms.